Welcome, welcome, welcome back, my Be Health Empowered family, to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. Of course, please call me Dr. Mel. And for those of you that are already in the family, you know why we are here each and every week. But so this is specifically for the newbies. We are here to make sure that you are getting all the information that you need to make wise health decisions, not just for yourself, but also for your family and even for your community. If it is your first time checking us out, please go ahead and hit that subscribe button if you're checking us out on YouTube, and hit that like button if you are finding us on Facebook. We really appreciate that. And, we are also here to make sure that you get all your questions answered. We would not be here if it wasn't for you. So please feel free to put your comments and especially your questions in the chat as we move through the show. Now, for those of you who are already part of the family, and if you're tuning in, you're now automatically part of the family, you know that I cannot do this without my incredible co-hosts, Miss Lila Mays and Mr. Wayne Bruce. Please come on in, join me in the studio. Tell me what's the word. How y'all doing?
The word is the word. Happy Monday.
Happy Monday.
Happy Monday, Dr. Mel. How's it
Yes.
Good.
It's going good. Keeping my chin up. It's a lot. We're going to talk about a lot today.
It's a lot going on.
There's a lot going on.
It's a lot going on.
So
just want to remind everybody, just try to find your peace in all this.
Right. And I'm so glad that, our very first show out of the gate this year was about covering our wellness roadmap, right? What our wellness roadmap was going to be for 2025, because I think we're all going to need it, right? Exactly. So if y'all didn't see that episode live, go back and check it out. It's on YouTube at Dr. Melissa Clark.
Indeed. Yeah. Lots happening. The rapid fire, all kinds of things in the government, etc., etc. A lot. Head is on a swivel, especially here in Southern California.
Yeah. For multiple reasons.
A lot of people are angry.
Yeah.
I've been in so many conversations with people about how these changes are going to affect the Black community and the country in general. But what they say, when America gets a cold, Black folks get pneumonia, right?
Right. Yep. Exactly. Well, that is why we're here today. That's leading into the topic of the show today. What is going on? The health edition. And we're going to tackle it all today. We're going to talk about how this incoming administration, with all these fast and furious changes, what that means for our personal health. And as I said in the introduction, the health of our families and the health of our communities. We have an incredible friend of the show, Reed Tuckson, who is going to be joining us soon. He is a public health giant, and he is going to be talking to us about all this stuff. So y'all make sure, you keep it locked. Keep it locked.
Keep it locked. But before we do, we have to go to the week that was in health and wellness. Recap.
The weekly recap. What we got?
Dr. Mel. So look, this first recap thing hits me hard. I mean, it absolutely hits me hard. I use antibacterial soap, and I used to use it a lot before it started breaking me out. Like I had to do it, and I never found out the cause of the breakout until I finally went to a dermatologist that said, "You're allergic to antibacterial soap." Whoa. So I wasn't expecting this thing. Is it helpful or harmful?
So it turns out, well, it clearly was harmful for you, right? And that's because antibacterial soap has chemicals. One of them is triclosan, that make them harsh on the skin and even harsh on our environment when they get into the water supply. And a recent study came out that showed that regular soap and water, just the plain old everyday, what we grew up with as kids, soap and water, is just as effective as antibacterial soap in preventing the spread of germs, which is really why we wash our hands, right? And it's not just that antibacterial soaps perform no better than plain soap for illness prevention. It's because of that gentle, being gentler on the skin, gentler on the environment, and that also they don't wipe out the helpful bacteria that are on our skin that make up, you might have heard the term microbiome, all those uh, bacteria that are on our skin and in our body that actually perform helpful functions for us. So when we overuse antibacterial soap or use it, it actually kills off those good guys, the good bacteria too. So all those things to keep in mind.
Yeah, I'm gonna have to make sure Brother Tate watches this.
Now,
That's the thing about antibacterial.
because we men's, so we
So
use
you think you need extra strength, huh?
Yeah, we think we
Yeah.
need extra strength. Now, what about the liquid soap versus the bar soap? A lot of times the liquid soap is antibacterial and the bar soap isn't.
Right. No, that's a good question. And, bar soap is actually better to use than liquid soap, not just because of the antibacterial thing. Like you said, bar soap usually is not antibacterial, but it's because it comes with minimal packaging or packaging that can decompose easily and is generally free of harmful chemicals that might, affect the environment when disposed. So those plastic bottles that the liquid soap comes in, the bar soap avoids all of that. So
Right.
Bar soap kind of different when it's like two or more gathered. Like, you don't want everybody, that bar soap, you're going to have your own, like in college. Walked around
Okay,
with
there's
a little
nothing wrong
We
with
use
that.
bar soap. We grew up with bar soap. We all use
Right, and
bar
we're
soap.
still here.
We are
Right.
still here.
Just feel a little different when somebody, I don't know, Mel, Dr. Mel.
Well, if you need your own personal bar piece of soap, go for it.
Right.
But it's still better. It's still better than the liquid soap, and still better than the antibacterial.
Okay.
Okay.
That is
Yeah.
really good information. That's really, really good to know. All right. Update on hair chemicals and cancer. So we've done a couple of shows and have had some updates on using chemical hair straighteners. And there's some more updates on the risk of cancer, especially in Black women.
Okay.
Well, yeah. So if we know that if you use chemical hair straighteners that have formaldehyde in them, and if
Mhm.
you use them, in the past twice a year for 5 years, that puts you in the higher risk category for uterine cancer and breast cancer.
That's something.
That's
Yes,
Because it
because
really
many of
is.
us did. I know that I did.
I
You
did
know,
for
yeah,
years. My
yeah.
mother slapped a kitty kid on me when I was a kid, and then I went into that's not but
Whole nother
anyway,
story.
I mean, I think this is really important because Black women are the ones who use them the most. So, what's the latest, Dr. Mill?
Yeah. Well, the FDA has, many people have been lobbying them to ban formaldehyde, which is the culprit, right, in these
Mhm.
hair products ever since 2008. But they've actually been kind of kicking the can down the road. Then they ran into a delay with the first Trump administration, and now with this Trump administration, there's been a pause on all federal regulations, right? So it's going to get kicked
Right.
down the road even more. The good news is that some states, like Maryland, California, and Washington State, have already banned formaldehyde in hair products. Hopefully, more states will follow.
Mhm.
But in the meantime, until the FDA acts, we need to know what kind of products to avoid.
Right.
And so the best way to do that is to ask your salon professional, right? Is formaldehyde or formaldehyde like products in it? Or there's a list of ingredients: methylene glycol, methanediol, methanol, or formalin. All these things turn into formaldehyde once heat is applied. So if you put it on and then the hot water to rinse it out or blow dry, all those things will eventually turn into formaldehyde. So any of those things are no-goes. And I think,
I know do you have that link? We have a link for folks who want to, there we go. We have a QR code for folks who want to read up on it. But I think that's a really important piece about talking to your hairstylist, ask folks at the salon, and then read the labels. I think this show is so important, Dr. Mel, just the whole show, right? Because it is to empower us in terms of being advocates. We don't think about that necessarily when we're getting our nails done, when we're getting our hair done. And so we need to take these conversations into those salons as well.
Absolutely. We need to talk about those gel lights, those gel UV lights. I'm going to read up on those and get back to you all.
Okay.
Talk about gel nails.
I got you. Yeah. All right. So if y'all want to read up on this, there's a QR code.
Yeah. Right. And it specifically lists all the products that have formaldehyde in them that are on the market right now.
So I'm going to leave that
check
link
if yours
up.
is on there.
I'm going to leave that link up until we finish this segment. But hey, this is the year of change again. Every year is a year of change for me. And this year we're going to have a whole segment throughout the year following my weight loss journey.
All right.
I've agreed to it. I've talked to the producers of the show.
I'm so glad they're flexible.
They are flexible. They are so incredible. And we decided to follow my weight loss journey. However it'll be, whether it'll be, I'm going to pick a route and we're going to go with it. Is that cool with everybody? But I want to say part of that, we've been hearing about our body mass index for quite some time. BMI is a measure of how close or far we are to a healthy weight. How, it looks at how much we weigh relative to our height. I've been hearing it for years because I've been short, for most of my life. When I was a youngin', I was short. Then I grew up into this, the 6'5" guy I am now. And
the strapping young man.
It's amazing. Yeah. It's amazing what I was 5'5" for so long, and now I'm 6'7". It's just amazing.
And growing. And growing.
But I just heard that the American Medical Association says it's racist.
Talk about BMI?
BMI.
Well, I think the BMI falls short for a couple of reasons, and racist might be a strong word, but their position is that the BMI is based on historical data from white populations, and it doesn't take into account body shape, gender, age, race, or ethnicity. So, for example, if you're a Black woman, you carry more weight in your hip and thigh area than in your midsection versus a white woman who might be accumulating more weight around the middle. The white woman is actually at higher risk for heart disease and diabetes type 2 than a Black woman who's carrying it in her hips, the weight in the hips and thighs. Also, the weight part of the BMI calculation doesn't take into account muscle versus fat. So if muscle weighs more than fat, so it can sort of push that BMI up. So a short, muscular guy might come out as obese when he really isn't.
Right.
So I think that's where the problem comes in with BMI.
So is there another option that's more reliable?
Yes, and actually one that's easier to implement and figure out. All you need is a tape measure, and that can help you just take your waist circumference.
Say it 3 times fast.
Exactly. So how far, how large you are in the waist or small you are in the waist is a great proxy or substitute for understanding, whether how you are relative to a healthy weight. So if your waist circumference is over 35 inches for a woman or over 40 inches for a man, that means that you have excess fat. And that's more reliable because it really talks about the distribution of the weight in your body And that distribution is really what puts you at higher risk for high blood pressure, diabetes, heart disease, etc.
Well, being a man of my stature, because I'm 6'9",
Yeah.
that and as a kid I was just 5'2", right? And so
Right.
now I'm 6'9".
Uh-huh.
It's tough on me. It's been
Yeah.
really a tough
Yes,
journey here.
I imagine. I
Uh,
imagine so.
and so
Well, uh,
I'm just trying to get this BMI thing down. Not
Okay.
okay.
so much.
Well,
Well,
make sure you have some before and afters,
Right. I
right.
will.
of the height and everything, the weight and
The
the height.
height is
The
the
height,
important
weight,
one,
and the
because
height.
when you're 6'11" like myself, uh
You're
it,
close
it
to Kareem, who's 7'1",
well,
right?
Shaq and I used to, I used to walk Shaq to school in the morning,
Right.
because when you're
Mhm.
7'2", that's what happens.
Right, exactly.
Got to
Well, that
distribute
is
this
the
weight.
recap.
Wow.
That is the recap, and we're gonna make sure that you have a for real though. You know, I think following your journey is going to be very powerful. We're going to make sure that you have a tape measure,
Yeah.
and everyone else out there, grab that tape measure. It's a great way to follow your own journey as well.
Right.
That's a
And
really
I've
good
already
tip.
been body scanned,
Right.
because the thing couldn't hold me to scan the whole height and everything. 7'3".
Okay.
All
All
right.
right.
No.
What y'all think?
What do y'all think?
That is my absolute favorite thing. I'm
Yeah,
always going to say it because I love it. So we said
it's
this at the
lovely.
top of the we said this at the top of the show. There's a lot of stuff that's been happening around us in the government, all of that kind of stuff. So we just are doing a quick check-in. We didn't talk to the people on the street, but we want to know what you all are doing to safeguard your mental health. It's been quite a month and it's almost over. So, let us know how you're taking care of yourselves. Drop some stuff in the chat. Wayne,
Right.
what are
And
you doing?
maybe with the stuff that you're sharing, you might inspire somebody else who's listening. So feel free to share. And Wayne, what are you doing?
Well, I've like I said, we got this personal trainer, and I have been really trying to. It's been a challenging top of the year for
It
me.
it has.
If everybody doesn't know, and I'll just share, I lost a very. I can't even call him a friend. I had to call him a brother. You know, and that was very tough. And literally, it's you know 20 days of crying. At
Yeah.
some point you have to get some mental health things to do, so really uh just trying to focus on music more. And so those are the things I do, getting spiritually, reading spiritual word. And so I've been trying to chill. It's a real different environment for me, because it's funny when you lose those people who are close to you, who have not grown up with you all those years, but have gotten very close to you in a short period of time. It's tough.
Yeah.
So
It's hard.
Yeah,
yeah.
it is. And we, in addition to everything else going on, winter time is often a time when people get sick,
Yeah.
often a time when people leave us, sometimes prematurely.
Yeah.
And, managing that grief is huge. It's
Yeah.
huge.
Shout out to one of our listeners and followers, Gina B. Prince. She says she's made an effort to get the steps in and close the rings on her watch.
I know that's right. I
Oh,
love
come on,
that,
Gina B.
Gina B. I love it. I'm all about closing those rings, girl. That'll do it. That'll
Is
help
that
your
is that
mental
a thing,
for
huh?
sure.
That's the thing.
That's
I
great.
love
That's
that.
great. Well, I know I'm hoping folks are putting a lot of stuff in the chat, and you know, it's been a month, it's almost over, but whatever we develop, it's something we have to do every day if we finding that it works, because the stress is there every day, and regardless of where it's coming from. And so our wellness practice needs to be something that we do as often and as regularly as possible on a daily basis. So, well, thank you, Lila and Wayne. We're going to see you back in a little bit. We are going to jump into the show because I know Dr. Reed Tuckson, our special guest, is waiting in the wings. We already kind of set this up, right? We know that there's been a new administration in the White House. It's only been a week, but they've been busy. There have been a lot of executive orders, ending of diversity, equity, inclusion policies in the federal government, and also talk about ending them in the private sector as well. But there are specific things that in the health arena are going to potentially change. And so our wonderful guest, Dr. Reed Tuckson, is going to join us. He's held multiple high-level leadership positions across healthcare, including DC Commissioner of Public Health, co-founder of the Black Coalition Against COVID, and co-founder and chairman of the board of the Coalition for Trust for Health in Health and Science. So thank you for joining us, Dr. Tuckson. Really delighted you're here.
Great to be with you and with your great audience. Thank you.
All right. So let's jump right into it. And I'm just going to kind of set the table with this question. How, in general, can you explain how public health policies set by a presidential administration can impact everyday health and wellness for communities?
The answer is that it is overwhelming. And I think that it is so important that we understand why it's important to follow and track what any president does, but particularly this president. First of all, what the president can do with their administration is to set the tone, the goals, whether or not we are as a country are dedicated towards making sure that everyone possible can optimize their health and live the greatest possible life that they can. Setting out those broad goals are critical. I think we have already learned that this administration is not particularly interested in that as a priority. They certainly are not interested in that for everyone in the nation. They define a sense for us of what is optimal health. What does it mean to be healthy? And then how we organize our national and other assets to try to achieve that goal. The president has an opportunity to have a heavy influence on whom is important, whether or not there's going to be health equity as a key objective or not. We've already learned that this president could care less about equity. And so this is an important differentiation. The president has a chance to talk about, and to not talk, but to actually affect how we achieve these goals. The affordability of health services. For example, what services are eligible for coverage? That is a huge issue. We know now that reproductive rights kinds of things are going to be really an issue in terms of those services. And then finally, a couple just last ones. We know that the affordability, whether it is the availability of public insurance, Medicare and Medicaid, and I know we're going to talk about that later. How about drug prices? That's a key issue that the president has a great deal of control over. But for Black folks, I'm particularly interested in the role of a president in supporting community health engagement, community-based initiatives, community-based organizations, and whether or not the resources will be there to support that community-based work in the Black community. I have a feeling that we're not going to see much of that this time around. And then I think we have the importance of research. And whether or not the research agenda for the nation is robust, leading us to not only great new drug developments and other inventions, but leading us to understand the value of the things that are being developed so we can have cost-effective implementation. So those are some of the major ways by which a president can affect things.
Thank you. You know, you set the table so completely there. I just wanted to sort of highlight a couple of things you said. You know, diversity, equity, and inclusion, that equity piece as it applies to health, you sort of laid it out. You want everybody to be able to achieve optimal health, but we know that certain individuals and certain communities are behind the 8 ball because of historic and current policies, right? And so there needs to be additional work done to make sure that the playing field is level so that everybody can get optimal health. And then you mentioned community health. People may have heard the phrase, your zip code is more important than your genetic code. So where you live and the conditions under which you live is more important for optimal health. So what's happening on the ground in communities to make sure that communities are healthier. And then you mentioned affordability, which is really going to lead into my next question which is, going back, 10 years to the start of the Affordable Care Act or Obamacare. How did that actually help, that specific policy, help people get health insurance and access to health care?
I'm sure most people really would be more willing to applaud President Obama for this extraordinary thing called the Affordable Care Act. First of all, what it did was expanded health coverage. It increased the number of people who have health insurance by levels that we never even thought were possible in this country, including those who had pre-existing conditions. And that was the biggest hurdle of all to overcome. They made healthcare more affordable, required insurance companies to spend a minimum amount of premiums on medical care, and aims to prevent unreasonable rate increases. So it really looked at how insurance companies were spending their money and whether they're spending enough of their premium on actually improving healthcare and serving the health needs of people. That was extraordinary. There were great preventive services that the Affordable Care Act gave, covered screenings, preventive services, often for free or low deductibles or low copays. Emergency services were a part of that, Dr. Mel, requiring health plans to cover emergency department visits without prior authorization. Pediatric services for kids. The bill covered well child visits, immunizations, dental and vision care, kids under 19, and also young adult coverage. All of us who are parents of young adults, now we find that those kids can stay on the parents' insurance plans until they're 26. So there were so many things that did. One of the stellar legislative achievements in American history, and yet we almost take it for granted.
Yes. And I also want to throw in there mental health care, right? Mental health care became something that the plans that are under the Affordable Care Act have to offer, right? Have to cover, which wasn't the case before. And then what we saw is under the last Trump administration, enrollment in these health plans that are covered by the Affordable Care Act went down, but they hit record levels under President Biden because they provided more money as additional help for people to be able to afford the plans as a part of the COVID emergency. Actually, I think something like 24 million people have been enrolled for this year. So why are public health experts like yourself concerned about what might now happen under this administration with the ability to get health insurance for low-income Americans?
Well, the thing that's most frightening is the challenges to Medicaid. I am really, really terrified about what's going to happen there. And this Medicaid program, is extraordinarily important to people who are poor and low income people. And so I think that's really the key thing that makes us most nervous. And I think what we also find is that Trump is going to attack the Affordable Care Act itself. So before we even talk about Medicaid, let's talk about what he's doing under ACA. And you're right, there were 24 million people enrolled in ACA plans for 2025. And so what we're really worried now is what Trump says at the beginning of during the campaign is, I have a concept of a plan. You may recall that great quote.
Wow.
Well, it turns out he had more than just a concept of a plan. He knew exactly what he was going to do. And so what we can expect to happen now is that, he's already signed an executive order rescinding the Biden-Harris administration's protections for the Affordable Care Act and Medicaid. He's already rescinded the Biden-Harris order to lower drug costs. And now that the Republicans own the Congress and the Senate, we are really worried because there is a special program with these expanded premiums that will sunset in a year, at the end of this year, without congressional action. And so I'm really worried that they can just do nothing and it will weaken the Affordable Care Act. These kinds of things,
right? And
are really
I just
key.
want to highlight that the program that you said is going to sunset unless Congress takes action. Basically, it means that fewer people, especially those who make too much to be on Medicaid, but struggle nevertheless to afford health insurance, are not going to have the additional dollars from the federal government to be able to afford these plans. So more people are going to
And
end up
not only
uninsured.
that, just to make it even more dramatic, premiums will double or more on average for those who are subsidized in the 12 states who actually took advantage of this federal exchange that occurred during that time. So we're really expecting premiums to go way up for those kinds of people, which of course means it's unaffordable, which means that those people are going to get sick. And that means when they get sick, they won't have a place to go for care. So these have tragic consequences.
Absolutely. Now you mentioned Medicaid. Who is it? What is it? And who is it generally for? Like who qualifies for Medicaid?
Simply put, Medicaid is the nation's public health insurance program for people with low income. It covers more than 1 in 5 Americans, 90 million people, including many with complex and costly needs for care. Who's in it? Coverage for low income Medicare beneficiaries, helps them pay for premiums, cost sharing, and services. Combined state and federal Medicaid spending comprise almost 1/5, Dr. MEL, of all personal care spending in the US. It covers 4 in 10 children, 8 in 10 children in poverty, 1 in 6 adults, and almost half of adults in poverty, 43% of non-elderly, non-institutionalized adults with disabilities, people with disabilities, 43%, 41% of all births in the United States covered by this. Nearly half of children with special health care needs, 5 in 8 nursing home residents. Think about that. When we think about Medicaid, a lot of times we think only about younger people or people of women and children. But remember, 40% of non-elderly adults with HIV and 23% of non-elderly adults with any mental illness, and 5 in 8 nursing home residents. All of those are covered. So the bottom line is that this is the principal source of long-term care coverage for people in the United States. Huge impact on every part of those people I mentioned, and every single state has a lot at stake here.
Yes. For example, when you say long-term care, think aging parents that have Alzheimer's. We know that disproportionately it's in the Black community. So that's going to affect the ability for those people to get care. The other myth, I think, too, is that it's only Black people on Medicaid, right? Only 20% of people on Medicaid are Black. 40% are white, 30% Hispanic, 5% Asian. So it affects all Americans of all hues. So it's a huge program. So now you said that you were concerned about Medicaid. What are your concerns about Medicaid? What do people need to know?
Well, what they need to know is that this program is going to be attacked. Every time you hear the federal, the Trump and his allies talk about we need to make a tax cut, when they start talking about cutting taxes, and they're basically making that tax cuts for the super rich like himself and Elon Musk and that crowd. But the only way that they can do that tax cut is, of course, to cut programs. And the places to get the programs cut are very limited. The highest risk part of the federal budget at risk now for being the ones to carry the burden of that tax cut will be people on Medicaid. That's where they're going to go. And so that's what is frightening, is that they're going to push hard to really cut back significantly on Medicaid. And they have a whole bunch of different ideas that they're going to try to go at it. But whether, regardless of how they do it, whether they make people have to have work requirements for eligibility, whether they put a cap on the total amount that the federal government sends to the states to run these programs, or they call it a block grant, which is just basically saying, okay, here's a pot of money. Good luck,
Right.
states. Figure it out how you're going to use it. Whatever mechanism they use, they're going to find a way. And so what we have to do is to be really, really engaged as advocates at the state legislature. Remember that there will be a lot of really bad pain on every state government, because there's still going to be sick people. There won't be the money that was there to take care of them, which means that the governors are going to have real problems. So if we want to be able to fight against this cut, we're going to need to have governors, particularly Republican governors, who are going to say, no, 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 you can't do that to my state. So I'm urging everyone in your audience to get tight with your state legislators and have them be really ready to make the arguments to the governor of your state so that we can at least try to prevent this horrible thing before it happens.
Yes. So get to know your state legislature. That is an action item. Um, so let's go to prescription drug prices. So many, we're kind of rolling through these, but I want to make sure we hit on these important ones. You mentioned prescription drug prices. What was happening under the Biden administration that is currently being reversed by this administration?
Again, one of the things that's so frustrating about politics is the average citizen doesn't even know the great things that a president like President Biden and Harris administration did. And one of the
Right.
great things that they did was to release a list recently of 15 additional drugs on top of other drugs that were already in the pipeline that will be subjected to Medicare price negotiation. So what they basically, for the first time in American history, have said that federal government programs that anyone that's being financed, health insurance is being paid for through Medicare, they deserve to pay lower and the cheapest possible drug prices. And so they are forcing the drug companies to negotiate those prices. And it was a very great model when it first started. And just before he left office, Biden added 15 more of these that will be subject to Medicare prices. The Inflation
Insulin is one of
Reduction Act,
those, right?
insulin is one of the major
Yeah.
ones of those. The Inflation Reduction Act directs the Department of Health and Services to negotiate these things. Unfortunately, on Monday, Trump signed an executive order reversing initiatives aimed at reducing prescription drug costs for Medicare and Medicaid recipients. He revoked an executive order that had directed Medicare, the Office of Medicare, to develop new experimental drug pricing models, so that whole work that started to do that is now gone. As well as but the good news is, in terms of insulin, the good news is so far he has not done anything yet to stop the $35 monthly cap on insulin or the $2,000 annual out-of-pocket cap on prescription drugs. So far, they haven't gotten to that yet, but we're going to have to really, really, really keep our eye on the prize. And the Democrats in Congress are going to have to really work hard to make sure that these signature programs that really are so important to every American, but especially the poor, will stay in business.
Right. And I mean, I don't have to tell my Be Health Empowered family what that means, but we know that there are often people that have to choose between food and taking their medicine, or paying their electric bill and paying their medicine, taking their medicine, right? And so these cost caps on medications are crucial for everyday people to be able to stick to taking their medicines on a regular basis. Um,
Yeah. And also, by the way, Dr. Mel, what it is it also starts to turn the corner on the kind of strategies that can be used with the drug industry to keep prices down. So just negotiating on the behalf of Medicare and Medicaid, that might start to open the door to other kinds of price negotiations. And I think that's what Trump is really in league with others to try to prevent.
yes, absolutely. So, I want to make sure I get this in because it's almost time to bring the audience in. Um, so, I mentioned your huge role as co-founder and chairman of the Coalition for Trust in Health and Science. Um, can you tell us a little bit about that initiative and why you think that's going to be even more important coming up in the days and months to follow?
When we and you were key part of the effort that we launched, you were one of the founders of the Black Coalition Against COVID. And what we learned there, of course, was that we knew we were going to have to overcome enormous amounts of legitimately, historically generated mistrust, and also have to fight being targeted as a Black community with lots of misinformation. And we saw that. But what we learned, Dr. Mel, was that that with the concerted effort of the entire Black community, working really well with our medical folk, our religious folks, our social and fraternal organizations, we closed the disparities gap in healthcare, in primary care. We closed the first time we ever closed the disparities gap. We saw it when we had primary series vaccination for COVID. Also, what most people don't realize is in the Black community, because of all the work we did, Black life expectancy in the second year of the pandemic was better than white America. And that's the key here. White Americans had their political leaders and others giving them misinformation that killed them. And so this notion of misinformation and distrust is not just a Black issue, it's an American issue. It's at the entire scale of the nation. So what I was able to do was to work with others and bring together for the first time in history the entire health ecosystem, all of it, from the doctors, the hospitals, the pharmacy people, the health insurance people, the public health people, the home care people, community patient organizations. Every single part of the delivery system and the healthcare system is now organized and represented in this coalition. And we're dedicated, Dr. Mel, to fighting against misinformation and trying to reclaim trust by helping every American have access to science and evidence as they make personally appropriate choices and decisions for themselves, their families, and the communities in which they live.
Great. And so, we're all on board. It is time to bring back Lila and Wayne, see if there are any questions from the audience. Maybe it may overlap the questions we didn't get to. So yeah. Hey y'all. So
Hey.
what's going on in the chat? Do people have questions out there?
People definitely have questions. I found a really good one about oh, here we go. Lana Perry asks about her Prolia injections. They went from $125 to $1,025 every 6 months. Why? Question mark, question mark, question mark. Is this an example of what's happening?
Yeah, probably not an example here, but more in the notion of what that particular pharmaceutical manufacturer felt that they could get away with legitimately. And so those prices do go up as they attempt to give them the best argument that for their side of it is that there is a need to pay back the investors who put the money into helping them develop the program. It takes a lot of money to do all the work to find a drug, see if it works, do the clinical trials, do the testing, get approvals, and so forth and so on. On the other hand, is that a legitimate and reasonable price increase? Though that's pretty hard to understand that go up that much. And so, but these are within the purview of the industry. That's why it's going to be so important that there be caps. That there is going to be support, legislatively to try to prohibit companies from being outrageous in terms of their price increases.
Okay.
Yeah. Exactly.
Yep.
Okay. I thought you were going to say something else, Dr. Mill. This is for you, Reed.
Actually, I will. I'm sorry. Let me just say one thing.
No, go ahead. Okay.
Most drug companies have some sort of program to assist people with paying. So it would be good to go to that manufacturer's website for Prolia and just double check and see if there is some assistance program. Just want to get that in there.
No, I think that's a great point. There are lots of, I see oftentimes coupons and all kinds of things on these sites for injectables. So maybe.
Yep, exactly.
I think that's a really good idea. You both mentioned the community getting to know their local Congress people, council people, and sometimes that can be overwhelming just to go and search and where exactly am I and that kind of thing. Any tips about how to get in touch with or get to know our local folks better?
Great. Well, the easiest way, by the way, is just go ahead and put in your search engine your zip code and say who's the congressional representative for my zip code, and it's usually pretty much that. And they may give you a couple of two different names, and then you just sort of work through that. But call the election, the Board of Elections, call for the local state, the state Department of Elections.
think
Uh-oh.
we I
Yeah.
think
Well,
Dr. Reed.
yeah, he'll come back. But I think in the meantime, as he was saying, call the State Board of Elections, Google it using your zip code. And then oftentimes they'll list the contact information, often the phone number or the email, and just dropping emails in the chat in to these representatives, state representatives, about these specific issues, whether it be Medicaid, whether it be prescription drugs, whether it be your state's policy on the Affordable Care Act health plans in your state and whether there'll be subsidies for them. Let them know how you feel, both your state legislators as well as your representatives to Congress and to Senate.
I I have two incredible questions, but I can only take one of them. But it comes from I believe that's Dr. Wayne Moore there. He says Trump's abolishment of White House Office of Gun Violence Prevention will impact us how? How do you think that, Dr. Moore?
So I think there's a couple of things. One is, there's been a big push for research on gun violence, and that was not funded for many years. Now, by eliminating that, any chances of additional research dollars going to understanding gun violence and gun violence prevention goes away. Plus, any federal initiatives to decrease gun violence. There are many that are funded through hospitals, for example. There are many direct community violence interrupters. We've had them on this program that are federally and state funded, and that state funds may be supplemented by federal funds. So the actual work of violence interruption to decrease gun violence may decrease. So those are definitely two ways that I could think of immediately where we might see some changes happening with addressing gun violence.
All right, we got Dr. Tuckson back in. Let's get him there.
Yeah, so we're having storms here in
Hey
Atlanta,
there.
so I'm so sorry.
All right, no worries. I'm glad you weathered the storm and came on back.
Me too. I don't know if he heard that question, but I think that'd be great for him to weigh in on.
Let's
To weigh
chime
in on,
this
absolutely.
question, Dr. Tuckson. Dr. Wayne Moore, who he said your brother Wayne and were very critical to his medical career, asked a question here. He says Trump's abolishment of the White House Office of Gun Violence Prevention will impact us how?
Boy, first of all, it is significant. What it first of all will do is to will ensure that we will not get from the federal government any research that will teach us about best methods of dealing with guns. It will not teach us about violence and prevention of violence. It will not. It really just takes away any sense that we will have an informed best practices conversation about this issue. Furthermore, what it does is to eliminate any chance for any regulatory controls over who has access to or to purchase firearms, because there won't be any sense of the data that talks about the harms. So it is clear that it's a move to really be in bed with the NRA. When yet again, the next time that we have a tragic school shooting, God forbid, but we know it's going to be there. All we will do is we will offer prayers, but we will not offer any legislative solutions. So it's a huge issue.
And I would just add on to that, there's a concern as well that rather than thinking about the root causes of gun violence, that the knee-jerk response to sending in the military to occupy Chicago will be sort of the law and order solution will be the default, as opposed to addressing the root causes of gun violence, which is what the research does to highlight and bring those to the fore and test solutions that actually might work.
I really think Dr. Mel's point is very important about the military. Now that Hedgepath is now the new Secretary of Defense. There will be very little constraints from anyone thinking of any constitutional issues to mobilize the United States military against the United States people. This is going to be something that we will really need to watch very carefully, but this is a possibility, more than a possibility now. And so you remember when President Trump in his prior office, marched down out of the White House over to the Episcopal Church with the head of the military there with him. That person, said that was the wrong thing to do. And regretted it. And of course, he's been now fired and his pictures taken out of the Pentagon already. But this new person will not have any such constraints.
Wow. That's sad.
That is heavy.
It's sobering.
That's sobering.
Very sobering.
Sad and sobering. Yeah, it is. Had a question myself. I had a personal question. I mean, we've been down this road before with other presidents, not this far. I just want to know, I wrote it down from a historical perspective. How do you think this administration's policies are going to compare to the past policies of presidents, not in our lifetime, because I know they don't, but how far back do we have to go to get a policy that matches this policy? I mean, historically.
Or conversely, strategies for resilience and addressing being the resistance to those things that might be harmful to communities of color.
Yeah. Well, I don't think there is a precedent, and that's because the range of variables that we have today are so different than back then. We didn't have the issues for health insurance that we will play out with. I mean, there's so many things that they did not even have in place back then. I think that what you are really getting at, though, is it unprecedented in American history to have leaders of the country who have hatred for parts of the other parts of the country, who do not view every person that lives in the society to be a human with equal dignity and worth as another. Do we have had that before? A lot. Is this new in that regard? Hell no. This is not new. And I think that we just have to remember that as much as we would have hoped and thought that this country was moving forward sequentially to getting us to a place where you could have a President Obama, because the country moved in such a direction to have a president like Obama, is exactly why they are now saying, hell no, that is not going to happen again. I think it's important that we realize that, years ago when the data came out that said America's headed to being a majority minority country, hell no, that is not going to happen. We're not letting that happen. And so my point being that, is this new? It is not new. And the arc of history tells us that there have been these kinds of mean-spirited kinds of people before. However, history also tells us that you can come out of it, that you can move forward, that there is reason for hope, there is reason for optimism. And lastly, what I would remind us that with the civil rights movement, the key thing that was so important for the civil rights movement was television. It was showing the photos and the pictures. And I have a feeling that if they do the things as horrible as they are saying they're going to do, and grabbing human beings out of churches by their hair and putting them on, if that kind of thing gets in front of the American people, I have to have a feeling that we are not such a country that would be that callous to separate mothers from children and all of the things that they are talking about doing. I think that there are lots of reasons to believe that we can go forward and that there will be political coalesces and coalitions that will get us out of this mess.
Very briefly, what actions, so we talked about your congressman, are there any other sort of personal actions that people can take that you would recommend?
I really, really beg every one of you to do two things. Number one, go to your local community-based organizations and volunteer. What can I do to help you? Be a part of the movement of community assets on the ground. I guarantee you this, there are not going to be hardly any dollars from the federal government to support community-based programs. It's going to be on, if not us, who?
Right.
It's up to us. If Black Lives Matter, they got to matter to us first. And that means we got to support our own self and stop waiting for somebody else to come in on a white horse and save us. Death is the consequence of failure. We do not have the luxury of going, oh my God, the white man didn't give me what I needed, so therefore we just gonna roll over and die. Hell no. We did that when we fought the COVID pandemic. I remind you, Black life expectancy was better than white America the second year. We can save our own lives. The second thing I'm asking you to do is get with the teachers of the Science Teachers Association in your county and find out from them, what do you need to do to support the science education budget in the local schools? We cannot continue to turn out young people into young adulthood who do not understand the basic science of scientific principles and don't understand the science around how health is administered. Health will be the number 2 or 1 expenditure in their lives. The decisions they have to make are going to be complex in a genetic era. There's a lot of more complexity. The new drugs that are coming forward, the new innovations, it requires a scientifically literate human being to participate. I'm begging you, find out about what your science teachers need and support their budgets and their learning while you're also going out there and joining and volunteering with your community organizations.
Dr. Tuckson needs a hand clap on that one, Wayne.
That's right. That's right.
Yeah.
Well said. Well said. And not just to understand, but also to lead the next Kizzmekia Corbett, right? The next George Washington Carver, the next, that's what we need to be also fostering and make sure gets the opportunity to lead.
And that's a
and the new doctor.
That's a perfect note to leave our audience on, Dr. Mel.
Absolutely. I think my producer is telling me that we need to wrap up. Dr. Tuckson, thank you so much. As always, you laid it out for us brilliantly. Wayne and Lila, as always, thank you all for bringing the word from the streets. Thank you, my Be Health Empowered audience, for those wonderful questions and comments and wellness tactics. Please stay well, guard your mental health. And until we see you next time, be wise, be well, and be health empowered. Thanks for joining.